So hello, my name is Arman Lateef, and I'm a rising junior at Colgan High School in Manassas, Virginia. I have a deep interest in environmental health, partly because I'm an asthma sufferer myself. And then in the future, I hope to pursue a degree in public health and study the genetic and epigenetic effects of environmental pollution. So my talk today is focused around three major goals. I want to describe the impact of air pollution on human health. I want to discuss potential mitigation measures such as mass, and then I hope to present personal lab research which attempted to assess health risks and mitigation measures using an animal model. So as we all know, air pollution is a serious global problem that threatens all living organisms. So what is air pollution and where does it come from? While there are some natural sources of air pollution, a lot of it comes from the burning of fossil fuels and its associated climate change. So some of the main sources of pollution include ozone, noxious gases, volatile organic compounds or VOCs, polycyclic aromatic hydrocarbons, and then what I mostly focused on, particulate matter or PM, which is composed of chemicals such as sulfates, nitrates, carbons, or mineral dust. So like I said, I'm focusing on particulate matter in my talk as it's known to account for the majority of pollution-induced health risks in the US. Um, this particulate matter includes fine inhalable particles with diameters that are generally less than 2.5 micrometers, called PM 2.5. And scientific evidence suggests that these PM 2.5 particles can be breathed deeply into the lungs, they can penetrate into indoor environments, and can cause cardiovascular diseases, chronic lung diseases, and strokes. And so people with heart or lung diseases, children, and older adults are most likely to be affected by particulate pollution exposure. So while we are mostly aware of the health risks of inhaled pollution, we may not realize the burden of disease this also places on successive generations. So this is hypothesized to occur due to heritable genetic alterations, as well as altered gene expression or epigenetic factors. And so a couple examples of poor outcomes are listed on the screen. So exposure to fine particulate air pollution like PM 2.5 has been linked with significantly increased risk of autism spectrum disorder, ASD, in children, particularly if exposure occurs during the third trimester of pregnancy or during early childhood. And then evidence also suggests that maternal exposure to air pollution during pregnancy is associated with increased risk of preterm labor, especially in the first trimester of the pregnancy. And then just another side effect of pollutants is an increased risk of low birth weight. So besides trying to lower our exposure, how does one protect biologic systems from these pollutants? So, well, people have tried a couple of things. There's some literature to suggest that surgical and bog masks, the ones that are on the screen, can be effective against filtering out pollutants. But the data is not consistent and does not examine health outcomes over time. And then vitamin B6 and vitamin B12 have been known to attenuate the mutagenicity and genotoxicity caused by environmental pollutants. And then in healthy adults, 2-hour PM 2.5 exposure substantially increases HR, reduces HRV, and increases WBC. And these effects can all be reduced by the vitamin B supplementation. So I was highly intrigued by the fact that despite the devastating impacts of inhaled pollution, we might have some strategies to mitigate these effects. And so looking through the literature, I did not find much research on these long-term effects and on future generations. And I honestly think the reasons for this seem somewhat obvious since human studies on such a topic would not be feasible and just many would need to be observed across a lifespan. And so using an animal model just appeared very promising. So the main goals of our project were to simulate a polluted environment and study the health effects on Drosophila and to determine whether these effects could be mitigated by a couple different face masks. And so without going into too much detail, I just wanted to give you a sense of my experimental setup and quickly summarize the results. And so just to let you guys know, I have published phase 1 of my findings in the Pre-Collegiate Global Health Review, and we're currently working on publishing phase 2. So like I said, we engineered a pollution chamber to simulate a real world environmental emergency. And so that's on the left of the screen. It was primarily made up of plexiglass and plywood sheets. And so since it'd be a little cumbersome to mask the flies, we masked the vials as shown in the bottom right of the screen. So our four experimental groups were, the first one was no exposure to pollution, covered with regular vial plugs, pollution only with no mask. And then the doctor's mask and VOG mask were cut into circular pieces and used to cover the doctor's mask and VOG mask vials respectively. And so using this data, survival curves were plotted using a Kaplan-Meier model. So the doctor's mask did almost the same as the pollution group, while the VOG mask group was much better. So Drosophila not exposed to pollution lived the longest, while pollution exposed Drosophila without any mask died the earliest. So in fact, their lifespan decreased by about 80%. And so the group that was exposed to pollution but shielded by the VOG mask did better than the pollution group without a mask, but not as well as the controls. So to summarize, I guess, the VOG mask was able to protect the Drosophila or the flies from the hazards of air pollution to some extent, but it definitely was not as healthy as just breathing clean air. And then on the right, you can see means and standard errors were calculated for the number of pupae in each experimental group. And so on day 5, the control group had significantly more offspring than any of the pollution exposed groups. And then among those exposed to pollution, the Drosophila covered by the VOG mask did better than the doctor's mask, while the no mask group did the worst. And so just to summarize again, the doctors and VOG mask showed a significant effect in terms of filtering out pollutants. Pollution significantly decreased the lifespan of Drosophila melanogaster, and the VOG mask was able to mitigate this effect. Pollution diminished Drosophila fertility, but those shielded by the VOG mask did better. And then protecting the parental generation with a VOG mask did not diminish the effect of pollution on lifespan, physical structure, or learning in the offspring. So I'd just like to conclude by saying pollution has a profound impact on health for successive generations. While mass offers some relief from adverse health effects of inhaled pollution, and prenatal vitamin supplementation may offer some protection from these detrimental health effects in offspring, but neither intervention can replace breathing in clean air. And then here are my references. Thank you so much for listening to my presentation.